Hi, everyone. We have our first official guest. And before we introduce her, just a little background on kind of how this got started. So, May is Maternal Mental Health Awareness Month, and Natasha and I wanted to have someone on who could shed some light on all the different things that women can experience postpartum and how common it can be, and how a lot of people don't feel like they get the support they need postpartum. We have our 6-week checkup with our OB, and then you feel thrown into the trenches. And a lot of people don't know who to turn to or how to even voice what they're experiencing and define what they're experiencing. So that's what we want to make sure we get across today. We recently got introduced to Tatiana here. Do you want to jump in to give the background on who you are and what
Yeah,
you
of
do?
course. So my name is Tatiana Betancourt. I'm a licensed clinical social worker and a psychotherapist in private practice. I also work in a hospital setting, specializing in providing therapy and resources for any women's health issue. So I started my journey through mood disorders, eating disorders, and found myself involving myself more and more in issues related to maternal mental health, whether it was OCD practice, different bipolar disorders, and I had the opportunity to be involved in opening up a program for maternal mental health. And it just came at the most perfect time in my life because I was postpartum. I think at that point I had been about a year postpartum, and I just, from a both like therapeutic perspective, was so ready to take on that challenge, but also I'd been through it and I knew what it was like. And it just created such a huge passion of mine. I love talking about this. I love supporting women. So yeah, it's so important for us to really bring awareness to this issue.
It's really cool. Once you go through it, you're like, I gotta help other moms, right?
Definitely. You want like no one to go untouched.
And that's why we started the podcast, because we felt like we could teach classes locally, but how could we reach more women and make information more accessible, low or no cost? So we're super passionate about it. And it's so nice to chat with someone like minded who's passionate about it too. So that's Tatiana.
To start, just so the audience is aware, what are the common perinatal mood disorders
Yeah.
and the most common that you would see in your practice day to
Mhm.
day?
So I think one of the most interesting things is the expansion of what that means, right? We oftentimes think of like postpartum depression or postpartum anxiety, and our definition has been expanded to include all of pregnancy. So it's the moment of conception through about, I would say, like a year or two postpartum. There's some disagreement in the field about how long we diagnose, but you're going to see everything related to either a mood or anxiety disorder. So under the mood disorders, you're going to see depression, bipolar, and under anxiety, you're going to see postpartum anxiety, postpartum OCD that is not talked about enough, issues related to psychosis, which are far less common, but so critical to treat really early on. And I see a little bit of everything, which is just, I think, remarkable in the field that regardless of whether or not you've experienced something like OCD before or bipolar before, going through pregnancy and postpartum, this can become a part of your life. You're wildly unprepared to deal with it.
We saw a stat that said that 1 in 5 women experience mood disorder throughout pregnancy or postpartum. Do you feel like that is accurate?
Oh, definitely not. Statistic is a newer statistic, but one of the issues with it really is that women's health issues is just so under researched. On top of that, we have all of these different populations that are under researched as well, whether that's people of color, different communities. So I would say it's far larger than that, unfortunately. The other thing, too, that we don't see is assessment. So we're really not getting a very accurate number. Providers are really not assessing. I think we're seeing it a lot more now. But even when they do assess, they don't know what to do once they get a positive result, right? So going beyond assessment, it's just really hard to have education around how to treat it and what to do when someone is actually experiencing something related to their anxiety.
we were just talking about this before this call, is it has to be so much more than that, because when we go in, for example, and we're given the Edinburgh
Mhm.
scale of depression, we know so many moms who, when we ask, they're like, we just kind of filled it out and lied because, what's going to happen if we do fill it out
Totally.
correctly? Is there any follow up? What happens? We don't want to get in trouble, or trying to figure out how to take care of our child and how to how to breastfeed and do all of these things. And every mother I've spoken to has had one of the things that you have mentioned
Mhm.
before, whether it's OCD, anxiety, depression, something.
Well, and it's interesting that you say that now it's including pregnancy and maybe up to 2 years, including weaning and all of the hormone changes then, because obviously, right? There's so many changes happening in the female body. And I mean, I know from my experience, I felt like that was when I experienced postpartum depression. When I weaned my son, no one talks about it. And I'm glad that they're redefining what it all encompasses.
Yeah.
Can you kind of walk through the difference between baby blues versus postpartum depression, and how someone can kind of identify whether they need to seek out different help?
The difficult thing about this is that the baby blues and postpartum depression, they're going to look very similar. So symptoms are virtually identical. The big distinguisher with this is it lasting beyond 2 weeks? So we're looking at duration. We're also looking at symptom intensity, and we're looking at level of functioning. So is it impacting your level of functioning to where you're having a hard time eating? You're having a hard time taking care of yourself, getting in the shower, basic needs? And is it lasting beyond those 2 weeks? It's hard for us to know. I mean, I remember being postpartum, I didn't know what an hour was or 2 weeks was, right? Like you really don't realize how long you're suffering and how long this is going on. So the trouble is, no one really sees women beyond 6 weeks. And even after that 6 week appointment, right? It's like a let's check the boxes, you're good to go. These mood disorders really peak at 3 months postpartum. So at that point, nobody is being seen. And to your point, Natasha, about weaning, that is such a huge point in somebody's postpartum experience where that mood disorder, anxiety disorder is going to peak. So I really think it takes not only support from a provider, but also our family's support to say, like, hey, this has been going on for this long, right? Maybe it's time for us to seek some support or some help, because I think a lot of times we're kind of lost in the haze of this postpartum period, and it's hard to know how long I've been suffering.
Right. And I think it's really hard. Hindsight's 2020. I didn't really notice in my day to day, just because you're so in it, what was going on when I weaned my son. But looking back, I'm like, ooh, that was some diagnosable postpartum depression, very textbook. And although it passed, and so it didn't last a long time, it was definitely uncomfortable. So, like you said, family checking in and just making sure your village is supporting you. And that's what we've been talking about a lot, is because the system is not set up to check on women. The 6 week appointment, you go see your OB, they check you physically, they maybe have you do a questionnaire about your mental health, and then they send you on your way. You might get checked on by your baby's pediatrician here and there. But like we talked about, a lot of people lie or feel uncomfortable talking to their pediatrician, this person they just met. Like, why am I doing this at my pediatrician's office? There's all kinds of thoughts and feelings around that. So how can we set up our village while we're pregnant or even before that, so that we have the support that we need throughout pregnancy and postpartum, just so that we're being checked on? Because you have to seek that stuff out. You have to do the research yourself. It just feels like one more thing on your plate when you already are so depleted and your mental load is higher than ever. So how can we set ourselves up, set our friends up, set the community up with better checks for postpartum moms? What do you think?
Yeah, it almost feels like something's missing in the pregnancy stage, because
Mm-hmm.
postpartum feels like it's too late.
Mhm.
It feels like
Right.
there's too much happening. You're in the weeds. It's too difficult to go and seek out a therapist who you don't have a relationship with
Mhm.
yet. So it
Mm-hmm.
feels like something's missing in the earlier phase where
Yeah.
you can establish care, and it's clear everyone needs this. And it just feels like postpartum's too late. Obviously, it's a much bigger question, and you can't fix society in a Zoom call. But But what do you feel like is the missing piece? What do you feel like women could potentially seek out during pregnancy or
or
what's missing
before.
or
I
before?
have so many thoughts. I mean, first off, women shouldn't be the ones having to make sure that they're prepared and have all of this, education just in case they experience something, right? I really think that it comes from like a macro level policy place where something needs to change. And I think a big piece of that is education, assessment, and we need to catch women going through our offices, whether it's early on in fertility treatments, whether it's going through pregnancy. I mean, we're seeing a provider every month, then every 2 weeks, and then every week, right? These are perfect opportunities to catch women. It should not be on the pregnant person or family to catch a mood disorder or an anxiety disorder, right? I really don't think that fair. And it's also, we're not in the best spot to catch ourselves, right? So this really has to come from a policy perspective or macro level perspective. And that is starting to change, but of course it's going to take some time, right? So that's why you are seeing the EPDS, you're seeing the GAD, you're seeing the PHQ-9, all of these evidence-based assessment tools that we're starting to incorporate, but it's just not reached everybody quite yet, right? I think the other thing that you mentioned was, why am I doing this assessment? And what are you going to do with this information? I don't even know you, right? And there's a lot of fears of, if I say yes to having scary thoughts, well, what does that mean for me? What does that mean for my family? What does that mean for my baby? And I think that, as a mother, one of our biggest fears is something happening to our child, right? And if I don't trust what your intentions are, or I don't trust where this information is going, I'm not going to share it with you. And so that's one of the things that I'm most passionate about is virtually every woman that is either pregnant or postpartum has had some level of thoughts that they are finding are uncommon to them, maybe not like them, and for some very scary, right? And that's obviously happens, on a scale. But I really think that we need to do a better job at providing information at assessment and also normalizing that these thoughts are very common. And that doesn't mean that I'm going to be, calling CPS or getting anybody involved. I know and trust that this is a symptom of what's going on and you're going to get appropriate treatment for it if you desire it, right? So just giving more information and really normalizing these symptoms, I think, is so important because women might be scared to say, yes, I haven't been sleeping, or yes, I'm checking on the baby all the time and waking them up because they're, I'm afraid that they're not breathing, or I'm having these scary thoughts about being on the stairs with my child. That all needs to be normalized so we can create an environment where women can share. We can feel comfortable doing so.
The stairs thing happens to me all the
Big
time.
one.
Wait, what's the stairs thing?
Just being on the stairs, holding my baby, and my palms are sweating.
Yeah.
Holding my baby. What if I fall? What if I fall on her? What if I
Yeah.
drop her? I mean, because I'm 8 months postpartum right now, and I feel like I had that with my son, and I was like, oh my gosh, I'm a monster. And, everyone has those thoughts.
That is what got me started with this whole process, really is I was treating women and men at the time with mood disorders, and had this patient, I'll never forget her, and she was having so many intrusive thoughts. And that's where my passion for this really was sparked, because the treatment that we can provide is crucial in them getting better, and it works. The other piece is, not a lot of providers know what it is, and rarely do they know how to treat it, right? So what I see oftentimes in my practice is a woman coming in very bravely sharing these scary thoughts with me after having had a really bad experience at the ER or at their pediatrician's office where someone called CPS inappropriately or got someone else involved. So there's so many scary thoughts that we have, but they're normal in a lot of cases. And of course, there are situations where diagnostically we might be looking at something else, but for the most part, every person, every mother is going to have some intrusive thoughts, and those vary a lot. But we really, I think, have to know how to catch it, how to treat it, and how to communicate with our patients that these thoughts are totally normal. And, the stairs one, I think, is such a huge classic one. I mean, we have a variety of them, and it's definitely normal.
I was just going to ask what the treatment
Me too.
is like
Yeah.
for that specifically.
Mhm. So one of the things that If we're looking at OCD in particular, which is not always the case, sometimes it's postpartum anxiety and it might look similar, but in most cases with OCD and a classic OCD, we're going to do some more intensive work, but we're doing exposure and response prevention treatment. So we're doing a lot of psychoeducation about what we're looking at, getting a really good foundational understanding, and then we're going through a series of hierarchy development and exposures to really treat this patient and get them to a better place.
So I come into you, I'm telling you that I am having these thoughts about falling with my baby, accidentally hurting my baby, and it's getting in the way of acting normally. Maybe I'm avoiding
Totally.
stairs. What do you say to that
Mhm.
person? Is it like a weekly appointment? And what is exposure? Do you say exposure
Yeah.
therapy?
Is that where you're having them kind of walk through it, go onto
Mhm.
stairs and
Eventually, right? I wouldn't probably put them on the stairs right away. I'll build some trust and get them to really kind of trust themselves. But first off, it's with a lot of education. Depends on severity and it depends on, what we need in terms of frequency of treatment. But, I work in a private practice setting, so I'm seeing patients weekly, sometimes twice a week if needed. But for the most part, we're doing weekly. And then if we do have someone with a more intense severity, then I'll see them in a hospital setting. So I'll bump up their level of care. We have a variety of different levels of care based on what somebody needs. But one of the places that I really start is there's a huge difference between a thought and a desire, right? If I'm having the thought, I am so afraid that I'm going to drop my baby, or I'm afraid to go on the stairs, or what if I fall on top of my baby, like you said? There is a big difference between having that as an intrusive thought that is undesired versus a thought that is desired and I have intention over, right? And so being able to understand clinically what the difference is and what that looks like is going to be huge. That's where I really start is that's so different, right? The other piece that's going on is our brains change when we're pregnant. Your brain is changing in order to catch fears and catch dangers directed toward your baby, right? So the fact that you're having that thought, I'm afraid to go on the stairs or I'm afraid to stand on a balcony, is biologically normal because our brains are changing. We're becoming mothers and we're having that, mom brain turn on where I'm supposed to know this thing is scary or dangerous. So I'm going to be a little extra cautious. That's biologically wired to protect our children. And it's normal for us to fear those thoughts, but they're actually normal. And they get to the place where they're overwhelming or they start to lead to, I could talk about this for hours, but there's typically like three behaviors that we engage in. It's either behavioral changes because of the thoughts, they can be avoidance behaviors, like you mentioned, or we can have these mental compulsions. So we need to look at what's going on for this individual and then treat that depending on what's going on. Yeah, I mean, our brain is changing and it's making us have those thoughts.
We just talked about the
mom
mom
Yeah.
brain.
brain and the pregnancy brain, and Taylor said, I think that mom brain actually is us getting smarter, right? We can multitask. We have
Totally.
all of these new thoughts and feelings, and it's making us better for our new role.
I loved what you said about how it's not on moms to, or it
Mhm.
shouldn't be on moms to identify these things. And there's something missing in society and policy and all of that. And I fully agree. And I think, though, that the issue is, like you said, it's moving so
Hmm.
slowly in terms of progress. And I love that a big part of when people seek you out for help is education
Mhm.
and trust first, and then moving on to the therapy. And I just want people who are listening to be able to get that, like how we differentiated between postpartum baby blues versus depression. If
Mhm.
you just could briefly describe that, because I know a lot of people who have some form of anxiety, right? And they can't really differentiate between whether it's just normal anxiety versus, this is postpartum anxiety or this is postpartum OCD.
Mhm.
Kind of what is the determining differentiation there? And when do you feel like it is necessary for people who are experiencing those things to seek help?
Hmm. I would say I mean, it's important to seek help whenever you're not feeling like yourself or you're feeling like you are doing things that are maybe uncharacteristic to you, or it's interfering in your daily life, right? There's a level of anxiety that's livable, but then there's a level of anxiety that starts to impact the way that we engage with ourselves, our partner, our baby, right? And so if you're ever at a place where you're feeling, I don't feel like myself, I feel like this is so overwhelming, this is too much. And if there's ever even thought in your mind that maybe I need some extra help, then go for it because the chances are it's probably gone on for too long and we should have intervened a little bit sooner. As moms, we wait so long because we're so used to just feeling like we have to do it on our own, feeling like we should be able to do it on our own, feeling guilty for asking for help. And so if you've gotten to that point where you're second guessing, then it's probably time.
Yeah, moms are always the I'm fine, but I'm fine. I have
Right.
this feeling, but I'm fine.
Right. And we're just so used to having no time to even think about what we need that we just continually rise to the occasion
Mhm.
because it's easier to do that. I just remember finding myself the first time around postpartum thinking, I don't even have time to think about what I want or need or what would be helpful. So I hired someone just so that I could have like 3 hours once a week to think about, okay, what do I need to take care of myself here? Because I don't even know what that
Mhm.
is. I have no clue.
And you can't even go to seek out help unless you're, finding someone to do that childcare. And
Right.
if you even have the resources and funds to seek help or get a
Mhm.
nanny, it's all very, it just seems,
Overwhelming.
yeah, overwhelming. And like we said, the barriers for access in postpartum care are just so high. Before I forget, what are the differentiating factors
Oh, right.
between postpartum anxiety versus OCD?
Do you want me to get clinical with it?
We love a definition.
Yeah, I don't even really know the difference between postpartum anxiety versus depression, but I feel like it's important for me and for all women to know at least the definitions because obviously so many of us are experiencing one or the other.
Or all of them. It might not just be one thing, right? It could be everything grouped together and it could come in waves. So it's just nice to know all of these markers and know that it could be all of them. It could be none. It could be one. It could be two if they last this long.
Mhm.
And you don't have to hit rock bottom to go get help.
Yeah, I always say like depression and anxiety are best friends, right? The likelihood that we have both is probably pretty high. I feel like they feed off of each other. But so perinatal depression is going to be any changes to your mood. So if you're starting to experience difficulty with sleep in either direction, whether it's sleeping too much or too little, which happens to all mothers, but the distinguishing factor is are you unable to sleep or having sleep disturbances outside of your child sleeping? Other ones are anhedonia, which is a loss of pleasure in what used to be pleasurable activities for depression. So the classic example I always think of is like going to the park with your kid and pushing them on the swing and them giggling or laughing and you're just not feeling what you feel you should feel and not experiencing that joy or maybe even not being able to laugh when they're laughing, right? Which is so common and we call it anhedonia clinically. It's a loss of pleasure in something that used to be pleasurable or could be pleasurable just because we don't have the ability to feel that right in that moment in time, which then caused a lot of guilt, a lot of shame. I should feel this way. Why am I not feeling this way? Right. So, um, other things that we're going to see are going to be a lot of negative self talk. There, it's kind of these fleeting thoughts or spiraling of thought. They're very negative feeling like a burden to your family or others, starting to have a lot of just negative dialogue, uh, whether that's once in a while or more chronically. Again, it depends on the severity. Anxiety, we're going to see a lot of agitation, chronic worry, just thinking about things over and over again, rumination. A classic example I always give is like maybe nursing your baby in the middle of the night and you're starting to go down that like Google, Reddit, Chat GBT spiral where you're like, is this normal? Right. And kind of going on and on and on and on, that chronic worry or feeling like something is wrong. The difference between depression and anxiety is really more so the direction of your thoughts. So with anxiety, it's going to be a lot of future worry. With depression, it's going to be a lot of ruminating about mistakes that I've made or ways that I've been a burden or ways that I haven't stepped up, right? So that's kind of where our brain likes to go with the two of them. And then with OCD, we're going to see uh, obsessions. So that's going to be any type of thought that's unwanted or undesired. And then a compulsive, typically behavior or mental compulsion or ritual of some sort to ease the anxiety of that. So that's how I like to distinguish the three of them. With OCD, again, you're going to see a lot of the rituals, which separates it from anxiety.
Like being obsessed with cleaning bottles or something in a way that's very intense. Is that
An example of that would be there's an obsession, right? So there's something wrong or some kind of intrusive thought about the bottle that would then lead me to engage in a ritual or a compulsive cleaning or checking of these bottles. So maybe the thought is, if I don't clean this bottle well enough, my baby's going to get a disease and that disease is going to become chronic, or maybe it's going to end in something catastrophic, right? So then I start engaging in these behaviors that relieve me of that anxiety. So that's that obsessive thought that goes to worst case scenario, elicits a lot of fear. And then the ritual would be engaging with cleaning behaviors.
That makes sense.
Yeah.
I feel like I've had all of
I know.
these. I was like, what's this sigh over here? This is our personal therapy.
I love it.
We should really be paying you.
No, that really is so helpful because listening to this, I mean, we obviously are thinking about our own experiences and you can be going through things, but just be so in it that you're incapable of seeing what is actually going on. I mean, I know so many who have experienced those things. And I feel like moms are like, I've got someone else to take care of. So I'm not going to take care of myself because I don't have the time, the resources.
I just was talking to my sister-in-law the other day, and her friend lives in Amsterdam. She was like, I had my midwife all through my pregnancy checking on me mentally and physically and emotionally. And then throughout my postpartum, they come and they check on you. And then they're kind of your therapist too. They talk about what are your fears? What's going on in your life? Are you going to see other moms, et cetera, et cetera? And she was nervous to take her baby on a walk because she was nervous about, forgetting something that she needed and being away from home and nursing in public under a cover. And she wasn't sure if she could do it. And she said, I'll go with you. We'll go on a walk together and we'll just kind of break that fear. And I was like, man, imagine if you just had someone coming to your house and checking on you. Yeah.
That's what I had.
Yeah.
I had midwives. And I do feel like my postpartum experience was very abnormal for an American woman, not that abnormal when you're thinking about other countries. But I do hear about my friends' postpartum experiences, and I realize how rare my care was because I had someone come visit me at 24 hours, at 48 hours, at 1 week, at 2 weeks. And then I visited them then in the birth center up till 3 months, which is really rare. And they really took their time with me. They were very focused on not just the baby checks and the weight and making sure everything's good with my baby. They were very focused on me, sending me personalized texts. And when we talk about the thing that is missing, I do feel like it's what midwives have figured out already postpartum. A midwife that I know here in San Diego is trying really hard to establish that co-care component with women who are using OBs in hospitals, and they can use her for continued postpartum care. And just having someone who you meet during pregnancy and is there to refer you out, to shelter you along, to check in on you, someone who is dedicated to you, not just baby, is so important. And I don't know how we get there, but I do think her doing that is a really cool step in the right direction. I don't know if there's a world in which one day, maybe it's not OBs. They have so much on their plate. Maybe it's someone else who is a postpartum specialist who you do see before, but continues on. And it's more about your well-being.
Well, it kind of reminds me. So Taylor did the doula training and then she also became a postpartum doula. So it kind of reminds me of that. Like if you could have your doula throughout pregnancy and then throughout postpartum, and I don't think that 3 months is even long enough. I mean, it should continue on longer, right? I felt like I was in the trenches until, I don't know, like yesterday, like maybe 6 months at the minimum, but like you said, to refer out to someone like you, Tatiana.
We don't have a designated person right now to do that. And a lot of the times people have to pay for a private doula. They're starting to be covered by insurance.
I will say, in my own experience, when I felt depressed, looking at the resource list and making the phone call to make an appointment and actually getting myself to the appointment, like I couldn't even get myself to make the phone call.
Mm-hmm.
The amount of times I canceled that appointment, you know? So just having someone set to come check on you and be like, okay, you are in a state that is not normal, but common, right? Let's get you out the door. Let's get you some care would be life-changing for so many American women.
Yeah, it's funny. People are like, don't go out of bed, don't go on a walk, but also come to the pediatrician appointment.
The first appointment, the first time, I will say the second time is easier, depending on your birth, obviously. But first time, like I couldn't even walk. And you're supposed to cart your baby around to the pediatrician?
I didn't, so don't ask me.
No.
I think it's hard enough to get yourself help when you're not a mom and you're not pregnant and you're not postpartum, right? And the amount of barriers are just exponential at that point. It makes it so hard for anyone to get help. I mean, I get referrals all the time where, you know, woman is not answering or not calling back or whatever. And when it is someone that's in the perinatal period, I know they're probably just not able to even check their voicemails, able to even call me back. Right. So the level of intervention that you need to use with postpartum mama looks so, so different than I really feel like any other population, right? Because they want the help, they need the help. They're just probably changing a diaper and in the midst of a really hard time and just unable to do so. So the way that we have to access and provide the care has to look so, so different because it's just a different beast. As I see a lot of women who are feeling very isolated, very alone, for the idea of having a community is like virtually non-existent. But that's where we need to provide practical support, right? Like if you are a partner, we need to be stepping in. Like, what do you need in order to make this appointment? Do you need me to answer the phone? Do you need me to call them back? Do you need me to grab the baby? Do you need, like, what do you need in this moment? Can't tell you how many phone calls I've gotten or like answers I've gotten where it's a mom or a sister-in-law or a partner saying like, hold on, she wants to talk to you, but she's in the shower or she's, you know, changing the baby or doing something. And so that ability to just connect someone and be there to support someone practically is so key because it's hard enough to get us to an appointment without any barriers. But now we have so many. On top of physically not doing well, emotionally not doing well, and just situationally having to be responsible full time for a completely different life and maybe just not being used to that yet, having your own kind of transition with that. It's just a lot. It makes it really hard.
Yeah. Unbelievably hard. And especially in the beginning, everyone's checking on you and maybe you have family visiting and you have people dropping off meals and then it's back to business as usual, right? The nuance kind of falls off. So we're just trying to figure out how we can help people bridge the gap.
Yes. Besides the things we talked about, tapping into community, do you know of any free, easy to reach virtual help, like a hotline, anything where if it's urgent, someone can get help immediately?
So two right off the bat that come to mind are Postpartum Health Alliance. So they have a hotline. One of my colleagues takes their calls all the time. We get a lot of referrals from her. So that number will connect you to a provider who is trained. What you want to look out for is someone who has a PMHC certification. So they have a perinatal health certification, and they are trained to assess, is there any suicidality? What level of care does this person need? And what level of support do they need? Whether that's doula services, lactation services, maybe more safety or higher needs interventions, a therapist. We have a ton of resources. So it's literally a phone call that you can make. That's PHA. You can look them up online. There's also Postpartum Support International. They have a hotline, but they also have so many great resources in terms of like information about medication, which we haven't talked about yet, but such a crucial piece of this too is there's such a lack of education about what medications are okay and what's available to women. There is so much more available and okay to take with very little risk factors. And so there's a lot of information on psi.com that you can find. This is a great resource, not just for women, but also providers. If they're ever wondering or needing some information, you also have a list on both sites that have PMHC certified providers. So this can be psychiatry, this can be therapy, but both have a really great hotline. They will connect you to someone that's in your community.
Amazing. Okay, that's what I was going to ask, because I'm just thinking about my experiences postpartum, and I would think that the recommendation would be to get connected with someone and start a relationship before, shit hits the fan. Not saying that it will, but I'd rather get ahead of it. Is that what you would recommend? Like, get onto one of those sites, figure out who you can get connected with, how your insurance, if they cover them or not, and get connected with someone early on and stick with them throughout your experience?
That would be ideal. It should be part of our birth preference list, right? Like, this is not only my pregnancy plan and who I'm going to see and who's going to support me, but this is what I want beyond delivery. We don't know what's going to happen at delivery, right? So many things can happen. And if you're already connected to somebody that you trust and that cares about you and is going to follow you, they're going to know and they're going to see those transitions in your health postpartum or even during pregnancy. So if we have that relationship already built, that's key. The other thing that is difficult too through insurance, a lot of therapists are not taking insurance anymore. I feel like we're seeing that more and more. There is an option that you can look into, which is called a super bill, that not a lot of people know about. Ideally, we see someone that's, connected to our insurance. I think that's great. And there are a lot of resources, but definitely something to look into because you can get an idea of what your reimbursement rate is going to be. And then you make the decision if you want to stick with that provider, if, you need a better fit for yourself and for your family. I feel like we have so many little groups popping up in San Diego of women that care so much and are doing so much. We're just not all connected yet. So
yeah, we got to figure out how we can get like a master list of all the people out there, all the providers, and figure out how to get it out to all the moms, because there's a disconnect happening, right? Like, the moms want it, the providers are there, everyone's passionate about it. Why is there the lack of communication? I know in my experience, right, when I left the hospital, I got a packet of, resources, and I never looked at it, which I'm not saying that's the right thing. I'm just saying that's what happened. And I'm sure I'm not the only one. I wish that I would have spent more time looking into postpartum support versus on Reddit, like, what bassinet do I need?
Yeah.
I think the amount of time we also spend preparing for labor and delivery is exponential compared to the time that we spend even talking about, hey, there is a likelihood that we could experience anxiety or depression, what to look out for and what to do. Right. I remember my husband and I took like an 8-week course on labor and delivery, which did not go as planned whatsoever. Right. And like spent no time talking about mental health, which, is such a, I think, common experience for so many women. So if we can make this part of uh, our preparation for delivery and postpartum, I think that would, put us all in a better place.
Yeah. And I do feel like it falls on those educators, though. When women are signing up for birth education, I would never teach a birth education course without going through the different things to look up, and that should be a part of the curriculum. And I feel the same way about breastfeeding education because so much of what we go through postpartum having to do with anxiety, OCD, depression, for me at least, was connected to my breastfeeding experience. So I would hope that all these different educators can kind of get on board realizing that this is something all women need to be educated about, because if women are taking the time to go to those classes during pregnancy, it's a missed opportunity to not be talking about those things.
Well, and it's doing them a disservice.
Yeah.
Because like you said, it should be a part of preparation. I mean, I told Taylor once, you're a pregnant princess and a postpartum peasant, because you get treated like incredibly throughout your pregnancy and someone's always checking on you. And then postpartum, it's not the same. And if we can get ahead of that and provide resources and have an 8-week class on mental health postpartum. I mean, can you imagine how much that would change people's experience? Just knowing anything about what to look for, what to expect. The buck just can't stop with birth. It's got to continue on. We've got to be able to support women better. So we could all talk about this for ages.
This was really helpful, though. I learned a lot.
Me too. Me too.
Thank you so much. This is awesome.
Thanks for taking the time.
Thank you so much for tuning in on today's episode with Tatiana for Maternal Mental Health Awareness Month.
Please don't hesitate to reach out if you guys ever need resources. We are here for you, and we will link out some in our socials after the episode. Tune in again next week.